The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
The psalmist David says, "Praise God, for I am fearfully and wonderfully made." What a great psalm to have. I want to welcome you to Wonderfully Made. I'm Dr. Jim Markham, and I want to thank you so much for inviting us into a home to be with you, to listen to the health message. Today we have an interesting topic. I'm a cardiologist. Normally don't talk about fields outside of cardiology, but today we're going to talk about integrative medicine. I find this very fascinating, and it's growing by leaps and bounds across America. And here with us to discuss it is Mr. Daniel Miller, and I want to thank you for joining us, Dan.
Thank you, Jim.
Listen, while you're here today, tell me a little bit about Heartwise Ministries. What's that all about?
Heartwise Ministries is a ministry that has been started as a result of the books that you have been writing. It was founded in 2005, and it's based on truth, biblical principles of truth, biblical principles of health, so on and so forth, truth, love, and in healing. Heartwise Ministries is a ministry that approaches people with a different thought process.
Okay.
One that does away with, say, guilt, so on and so forth.
So it starts with truth.
Correct.
And truth leads to love. Now, I see a lot of people talking about love in this world, okay, but you know, talking about it and showing love is two different
things.
Two different readings.
Correct.
One of my definitions of love is putting someone else's interest above yourself.
Right.
Okay, and of course the opposite of love we see is selfishness.
Correct.
And we see a lot of that. Now, part of the truth is not believing lies.
Correct.
You know, and I see that all the time in healthcare. You know, some people believe, you know, low fat, high fat will work better for you, or take this vitamin or this herb will do better than you. And I also see that damaging the body because they believe, for instance, if you believed that a cigarette was going to get you better, if you really believe that, that would damage you because, of course, the cigarette's going to damage you. Well, you can also take these health principles into the spiritual world.
Right.
Now, can you imagine if you believed, for instance, if you believed that you had to earn your way into heaven?
That's a perfect example, and it damages your brain, you know, your thought processes. And that's exactly what Heartwise Ministries is trying to get across. A ministry that approaches things from a very basic, simple direction. And that's,
you know, I think God wanted our health care to be simple. And there's more to healing than just healing a physical body. You know, healing the spiritual self. You know, it's happening in the mind. With that in mind, Heartwise Ministries gathers questions that people might have from all around the world. And if you might happen to have a question, make sure you get your questions into us. We're now on the web at heartwiseministries.org, www.heartwiseministries.org. You can send your questions. And what we do is we group them around topics, and we try to answer these questions from a biblical perspective. Some people around the world don't have anyone with healthcare knowledge or background to go to give them a biblical perspective.
That's very good, yes.
Okay, let's start with the first question.
Okay, first question is from Ann in Tampa, Florida. I listen to the radio a lot, especially on Sundays. I listen to Deborah Ray and Robert Scott Bell.
Okay.
I usually listen, it says loosely listen.
Okay.
They talk about integrative medicine. This is very interesting. I am not sure I know what this is. What is your take on this?
Okay. That is a great question, Ann, because many people now are using integrative medicine to take care of themselves. Another word for it is sometimes they call it complementary medicine, or some people call it alternative medicine. But I'm not sure that it really is alternative medicine, Dan. And let me sort of explain to Ann what my take is on it. Years ago, when someone was sick, the doctor there used to sort of minister to all their needs, their physical needs, their spiritual needs, their emotional needs. Used to use all sorts of tricks of the trade, and
Right.
there wasn't as many quote tricks as a trade as there is now.
Right.
Now, I was trained in traditional medicine, where we use a lot of pharmaceuticals, and unfortunately, many are just trained in that discipline. But if you think about pharmaceuticals, and pharmaceuticals change the chemical environment in their body. Now, there's other ways that can also change the chemical environment in the body. Now, let's think. Can you think of one that would change the chemistry of the body, Dan? Just off the top.
I would think positive thought process.
Exactly. Your thought, your mental
Right.
outlook.
Your mind is a very powerful
Right.
tool for you.
And one example of that is the placebo effect.
Correct.
You know, if you believe you're going to get better, 1 in 4 to 5 will get better.
So that's a pretty high percentage, actually.
Yeah, and that's a lot of this is, you know, it might not be the medicine that's working, it's that belief that you're being healed that's
Correct.
working.
Right.
Similarly, not only placebo effects, but we've also shown that in patients that a healing touch has occurred. Whether, you know, if I touch you and you believe in me and I say, Dan, you're going to get better. This is not a problem. It's going to be gone tomorrow.
Right.
There's a powerful ability just to have that reassurance that all of a sudden that symptom is gone.
To be told by somebody that knows what they're talking
Right.
about. It's very powerful.
For instance, I deal with a lot of people with chest pain. And sometimes I can come to them, and I know beyond a shadow of doubt that this chest pain is not coming from the heart. I know it's coming from stress. But by doing a test or proving it to them, you know, I can say, I give them that assurance. This, you know, you're assured. Your chemistry gets better when you have assurance.
Right.
Now, so we talked, you know, other ways you can change your chemistry. You know, getting back to that, you can change your chemistry by exercise,
Correct.
the food you eat, how well you rest, your spiritual status.
I think a lot of things, even down to the relationships that you have with friends,
Exactly.
family, so on and so forth, I think they have major impact on how you feel in your life.
So all of that, you know, comprises health. So, so anything that changes your chemistry can be affected by this integrative medicine. For instance, the herbs. You know, integrative medicine uses a lot of herbs in their use, but herbs are very similar to medicines. They change the chemical environment.
Correct.
Some people out there are using magnets, which I don't believe in, because I don't think that changes your chemical
Have they done
environment.
studies on that?
Yes, they've done studies on the magnets,
the
and
outcome on it?
the studies have not shown that they have any proven clinical benefit other than maybe a placebo benefit.
Right.
What are other things? Acupressure, chiropractic, you know, manipulating
Correct.
bones, massage. For instance, you know, if you know, the other day you told me you had a kink in your shoulder. Okay, when it's massaged, the body releases chemicals that help. You know, for instance, if someone hurt your arm, what's the first thing you do? You rub it. When you rub it, you bring
Releases.
in natural healing substances. So that's very important.
Right.
A lot of people don't realize that you can change your chemistry just by laughing. You know, if you get a good belly
Correct.
laugh,
And what does that cause?
It releases endorphins.
Okay.
You get a lot of endorphins. So I tell people just to go, you know, go around laughing, especially if you're in pain.
How do endorphins work?
Endorphins are the natural painkillers that the body produces. It's sort of the natural stress hormone.
That's basically what we're talking about
yes,
here.
Yeah, exactly. So in my take on integrative or complementary medicine, Ann, would be anything that changes the body's chemical from whatever means is seen as integrative medicine. And putting a bunch of these modalities together, we've got this integrative approach. And I think this is the best way if you can rule out what's true and what's not true.
Correct.
So I've had this problem of, you know, you see all these ads on the paper, Dan, and at the middle of the night, you know, this guy's touting, you know, high colonics.
Correct.
Have you heard of that one?
Yeah.
Well,
Yeah.
what is that all about?
Well, I think we've got a question that will approach that.
Okay, well, we'll talk
maybe
about
here in
you
a
know,
little
but
bit. I'm
you know,
not sure if I want to go there right now.
I don't want to go. But anyway, but the point is, you hear about these things.
Exactly. Let me ask you this:
Yeah.
What are some of the negative and the positive outcomes of integrative medicine?
Well, some of the positive outcomes is it merges the truth in a lot of different worlds.
Right.
Okay. For instance, if you can accomplish the same thing without taking a medication with the side effects, let's say you can lower your blood pressure and cut your stress down by regular exercise and proper rest and drinking enough water, wouldn't that be better than taking a blood pressure medicine?
Yes.
Well, that could be an integrative approach. How about for chronic back pain? If you could see a chiropractor that could manipulate certain ways and release medications, or
Correct.
deep massage that could help the pain that way, when that might be better than a pain medication.
Right.
It gets at the core of the problem. But likewise, integrative medicine, I think, also has to work on someone's spiritual side.
I believe so.
Because
yes.
you talked about all those things that damage. So I think that in knowing the truth, and that's what I've done, looked at, well, how do you know the truth? Well, I go back, I try to go back, in all these decisions, go back to the Bible, the real source of truth.
And prayer and the Holy Spirit helping you through your process.
Exactly, because, I admit, the more you learn, the less you know. And I feel like, as all these areas, I know so much less now than I used to. I almost feel humbled. And the only way I can do it is, look at the data that's available,
Right.
pray about it, ask about what the truth, and let God really lead me in love.
Right.
But that's one thing that I think is a universal healing, and that is the word love. God is love. I mean,
Well, it's biblically
and
taught as a principle.
gives you that assurance, and I think that's a healing force in itself.
Right.
But those are all the components, and that makes up integrative medicine and more. But I think we're going to hear so much more about this, because I think people want to get at the cause of their diseases.
Yeah.
They're tired of taking pills. They're tired of having procedures. That they want to be whole again.
Yeah, and this is an alternative way to do that.
Right, and I think you're going to hear a lot more about this over the next couple years.
All right, let's go to the next question. This is from Alan in England.
Okay.
Alan says, my home is in England near London. My cholesterol level has been high for several years.
Okay.
I have taken numerous medications, but they mess up my liver function. Are there ways to lower cholesterol other than medications?
Okay.
I guess my question to you right off the bat would be, what's cholesterol, and how does that affect us? How would it affect Alan?
Good. Okay. Well, cholesterol is a substance that's made up of lipids or fats. And unfortunately, in the last several years, our diet has changed to the point where we're taking in too much fat. I talk about fast food, but now it should be called fat food.
Right.
80 million people are eating this stuff every day. We don't exercise as much to burn off our fats, so the fats have to go somewhere. I knew a fellow the other day that I bumped into, and I says, well, how do you eat? And he says, well, I eat, he ate at Hardee's some biscuits and gravy.
Right.
At lunch, he had a burger, some hamburgers. At night, he didn't get off work till about 8 o'clock at night, so he had his big meal at night, heavy stuff.
Right.
And he usually had some ice cream with the meal at night, and then he went to bed.
Now, is this something that you recommend?
No, I don't recommend that stuff. But anyway, if you think about, now he didn't know better, bless his heart.
Yeah.
And I was trying to, give him a glimmer of truth. But if you do this over and over, this cholesterol or fats have to be stored somewhere. Well, unfortunately, it's being stored in the arteries of the heart, which can cause cardiovascular disease, in the artery of the necks. It can cause all sorts of problems. Not to mention that if you take this caloric input, sooner or later you're going to be obese.
Right.
So my approach to him was, this is what cholesterol does. It clogs up your system. So now, Alan's question was, is there ways to lower his cholesterol without taking a medication?
Correct.
Now, most of the cholesterol medicines out there are called statins. Okay, and they do work on the enzyme systems in the liver, and they can cause abnormalities in the liver function. So that's why if you're on a statin, you usually have your liver checked every so often,
right?
Depending on what that is. Well, he can't take it safely because it hurts his liver. Now, other things can bring down cholesterol nicely, and this is where you sort of integrate different approaches.
Correct, such as exercise.
Now, do you ever view exercise as a medication?
I believe.
Yeah.
It's very possible.
I mean, physiologically, exercise does a number of good things for the body. It lowers blood pressure, loses weight, cuts your stress level. So exercise would be treated as a medication.
Right. Eating correctly. That's kind of a no-brainer there.
Well, but that's hard in our society.
Well, yes, we have.
Now, I don't know what they eat in London, England, but I'm sure that their diet is not that dissimilar from what we're eating here.
Right.
And there's some other natural herbs. Let me talk about a couple of those.
Okay.
A lot of people don't know that soy products can lower your cholesterol. Okay, soy products.
Such as soy milk,
soybeans, anything
soy butter
made of soy that can lower it.
Okay.
There's these substances in India. They've used something for years called a Google gum.
Right.
It's Google, and that helps lower cholesterol there. Now, there's one that you hear a lot about called red yeast rice. That lowers cholesterol, but it has the same compound that our statins have in it.
Right.
So it can also affect your liver. So in Alan, that would probably be one you wouldn't want to take.
Right. Now, let me ask you this. Taking these natural products along with medications that he's already on, would that cause any conflict?
It could, because, you know, remember up front we said all of these things you put in your body from whatever stimulus you can, they
Right.
can always change your chemistry. So if you change your chemistry with a medication, change it with an herb, sometimes you could both work together and harm you even more.
Right.
So I view these herbs as similar to prescription medications.
So he's got to be very careful about
Yes.
what he might use
Yes.
that you've mentioned that's
Yeah.
as an alternative.
Because some of these can be very dangerous, but you know, we know that exercise is not going to hurt.
No.
We know that soy
Backing
products
off on your food.
and you know, there's some nuts that have been found very protective. Specifically, the two that I really highly promote is walnuts and almonds.
Correct.
And in some studies, they've lowered the chance of having a heart attack by up to 50%.
That's a huge...
Oh, I know, but you don't hear as much
percentage.
about eating nuts. You know, you hear about taking a statin, which lowers it too.
Right.
But you know,
Well, the statin is the easy way to do
right.
it.
But now think about this. Diet for years changes the body's chemistry. And we talk about soy lowering cholesterol, nuts helping you. Water is a tremendous thing to take too for
Cleanse the
treatment
body.
of disease. Right.
Right.
Okay, let's move to the next one.
Okay, this next question comes from Carter in Tennessee. Does coenzyme Q10 make your heart stronger? My grandma told me I should be taking this. I don't have heart problems. My grandma also says I should take tons of vitamins. He says, help.
Well, you know.
What is coenzyme Q10?
Well, coenzyme Q10 is a substance that's naturally released by the body that
Right.
helps muscle function. When should it be used? Well, if there's a deficiency in coenzyme Q10, it's used. It's never been proven to help a heart beat stronger, but a lot of people think it might work.
Right.
And that's what's interesting about integrative medicine, Dan, is most of the studies have never been done. Because there's no one that will fund the studies to study whether this therapy works better than this therapy and actually see how the interactions occur.
Right.
But now I do use coenzyme Q10 sometimes. For instance, if I had a person that had high cholesterol and they started having muscle soreness, I might give them coenzyme Q10.
Right.
Some athletes that have muscle soreness deplete coenzyme Q10, they benefit from it.
Correct.
If a person did have a weak heart and there was nothing else to do, I don't think it would hurt any. And a few studies have suggested that it might do some good.
Now, why would an athlete deplete that?
Well, because they use up their muscle. You know,
Okay.
they exercise something that I don't do, but they exercise all the time. They get soreness.
Right.
You know, soreness in their muscles. They're tearing their muscles down.
Right.
But now getting back to her question about tons of vitamins, I mean, lots of people take tons of vitamins now. And what I've been telling people is, you know, there's lots of supplements out there for vitamins, but God made it that if you eat fresh fruits, grains,
Good balanced diet.
right, with a wide variety of colors,
Right.
you get all of the nutrients that you need. Now, conversely, a lot of people don't eat that way.
Right. Well, it's very difficult.
Right. And in those people that don't eat that way, I do think they benefit from taking vitamin supplements.
Right.
Now, a lot of people think, though, that you're better absorbed if you eat your vitamins.
Right. Let me ask you this.
Yeah.
Is it possible that there are other supplements out there that do make the heart stronger also?
Oh, yeah. There are supplements out there, some we know about, some that we don't know
Correct.
about, that are out there that make the heart stronger
Right.
in different types of ways.
Right.
Okay, that was a good question from Carter.
And, you know, another side comment, there was generations different, I believe, on vitamin intake.
Oh, yeah.
I know the older generations seem to push vitamins on you, and the newer generations seem to go for the medications.
But you know, the newer generation probably eats worse than the older generation now.
Correct.
You know, they don't eat as much fruit, fresh vegetable salads that get all the vitamins that you need.
Right, right. Okay, next question. Over the last few years, my blood pressure has been running high. I took a prescription medication, but it made me nauseated and weak. Are there any natural measures I can take to lower my blood pressure? This comes from Stephanie in New Zealand.
That's a great question, Stephanie, and I get that all the time. The medicines that you take, none of them are free. They all come with some baggage. They all come with side
Correct.
effects. You know, it does one thing, but it alters your chemistry, just as we talked about. Unfortunately, when I talk to people about lowering their blood pressure naturally, Dan,
What do they do?
Well, sometimes they
kinda
don't like
look
it.
at you
For
in a
instance,
funny manner.
the first thing I like people to do is I cut out all the substances that can make your blood pressure go high.
Right.
I ask them if they smoke, consider not smoking. Caffeine raises up the blood pressure.
How about stresses in life?
Stress in life raises blood pressure. Salt or sodium content.
Right.
And a lot of people say, oh, I don't salt my food, but they eat a lot of canned foods,
Correct.
packaged
Processed foods have
all
a
of
lot
them have
of salt.
sodium in it. So first I say, well, can you exercise, do this? Can you do the rest first? You know, unfortunately, most people say, I don't want to do that. I'd rather take a medicine. Now, that's a sad
It's the easy way out.
That's a sad state. And,
Right.
I say, well, you know, our bodies weren't designed to take all this. They were designed for this natural health that God did.
Exactly.
And we break these laws, more bad things happen.
Right.
So I try to, you know, to meet them where they're at and say, let's pray about this. And why don't we try to do a walking program? Now, one of the things that causes high blood pressure now is this condition called sleep apnea.
Right.
So it's where
And what is sleep apnea?
that is a condition where people don't get enough air at night. It's like they're going underwater and they don't have enough
Okay.
air and they come up. It's usually because of an obstruction in the airway.
So then being tired all the time from lack of sleep causes high blood pressure then? Is that what you're saying?
Well, I'm saying the condition called sleep apnea because
Right.
your tissue's made to renew at
Correct.
night. Well, when the tissues don't renew at night, that puts stress on the body. The stress hormones that we've talked about in other shows,
Right.
the epinephrine, the cortisol, all of those things raise blood pressure. So I think any stressor on the body can raise blood pressure. If I punched you right here,
Right.
your blood pressure would go up. If you stayed awake for 2 or 3 days, that would put a stressor on
Right.
you. So I try to cut back all those external stresses. Even a bad relationship could raise blood pressure.
Oh, I can see that happening.
So these are the things that I would work on naturally first. Now, is there a natural herb or anything like that? I guess that's what she's asking too. But if you think about it, Dan, that's the same as taking a medicine.
Yeah,
Except-
it is.
except we
and then
miss-
you run into the same conflict that Alan had
Right.
from England. Let me ask you this. Would major lifestyle changes have an effect on her high blood pressure? And
Yeah, and major lifestyle checks would help greatly for the good. Now, one of the things I tell people to do is, do you take a day of rest? Do you sleep
Right.
well at night? Do you take
Right.
vacations? These could all be treated for. Are you happy with your job?
Correct.
I've seen people that retire from an unhappy job situation and their blood pressure comes right down.
Right.
But
what are some of the things that she can do, maybe from a lifestyle perspective, such as reading or, prayer, possibly introducing that into her life and allowing that the Holy Spirit to come into her life and make changes
Right.
within her life from biblical.
Well,
direction.
now you're getting at the core problem because you're giving her the power through God to physically make these changes that she does need to come back to the truth
Right.
that He designed us to be.
Right.
So I think that as you know God and how He's designed us and how us to work, if you can get back to that model, it's going to.
Then it allows you to naturally take care of
And it gives you a
problems.
greater chance of healing naturally without depending on extra blood. Now, do I use blood pressure medicines? Yes, I do. But is it my first choice? No, it's not.
Right.
But that's what integrative medicine is, using all these other techniques. Some people, for instance, relaxation music can bring the blood pressure down.
Right.
Therapeutic massage.
Correct.
All of these things can sort of relax the body. And other, for men, it might be playing golf.
Yeah.
But this is what integrative medicine is all
Well,
about.
for some people it'd be.
But
You don't want me to play golf.
no, it doesn't relax you, huh?
We missed one part of her
Okay.
question also. She made the comment that her prescription medicine made her nauseated and weak. Why would she be getting sick to her stomach because of her prescription medicine? Is it too strong a prescription?
Well, remember, all these medicines weren't made naturally for the body.
Right.
It might be that this is just upsetting her system. The system's trying to throw
Okay.
it off, and it says,
Okay.
no, this is a side effect. On almost every medication out there, one of the side effects is nausea.
Correct.
And every medicine I know almost can cause you to be sick at your
Okay.
stomach. That's why if you have to take a medicine, we try sometimes to try to take it on with a meal.
Right.
But now I think you're understanding, and I hope the audience is understanding what this integrative medicine's about. It's taking the best of many different worlds, looking at the Bible,
Different principles.
looking at the Bible, and seeing if we can stay within God's laws and God's precepts and coming up with a treatment plan.
Correct. All of his natural laws. All right, the next question. Herbs have been around for years and are precursors to many medications. What do you think about hawthorn for a weak heart?
Okay.
What is hawthorn anyway?
Hawthorn is a natural herb, okay, that's usually a leaf, and especially in Germany, they use this a lot for weak hearts, and it actually makes the heart squeeze stronger and pump better. Okay. So this is a very known herbal treatment in certain countries and in the United States. It's actually safer than some of the medicines we use to make the heart squeeze stronger. One of the medicines we used to use is a lot called digoxin.
Right.
Well, hawthorn is, in some studies, has shown it works just as good as that with less toxicities, as it causes less problems. So I think this is another example that in the herbal realm, but you do have to treat this like medicines. This one has been studied. Right. And one of the things that I've been going over is this integrative medicine. Well, this is an article that was written in 2005 that actually has gone over every study on these herbal supplements and actually shown which ones work, which ones don't work.
So are there other supplements then that would benefit her besides the hawthorn?
Well, it's according, if it's just for the weak heart, you know, hawthorn would. Remember we talked a little bit about coenzyme Q10? Right. Yeah.
What, such as ginkgo maybe?
Well, ginkgo biloba might help a little bit, but you know, different ones are for different things.
Okay.
Like for instance, you know, ginkgo and some of them might be used for as more of a stimulant, things like that.
Okay.
But there's also some bad ones too out there.
So there's just other. All right.
Right.
All right. Let's go to number 6.
Okay.
This is from Debbie in Indiana.
Okay.
She says, I take Coumadin because I had a blood clot in my lungs. What herbs should I avoid?
Okay, Debbie, excellent question.
What is Coumadin and what do they use it for?
Coumadin is a blood thinner, okay? Some people even have called it rat poison, Dan. And it's used to help prevent clots from forming in the body. For instance, the blood clot that goes to the lung is called a pulmonary embolism. All right. Remember the reporter that was in Iraq that was in a tank all day? Because his legs were like this, he got a pulmonary, and that's why I'm going to stretch out my legs right now. But you know, he got a blood clot. It went to his lungs. He died immediately. Right. So people that have that, it helps breaks up the clots. Clots anywhere in the body. Some people with strokes need to take certain types of Coumadin. Well, Coumadin is a blood thinner. No one likes to use it. I use it in a condition called atrial fibrillation. Okay. But Coumadin is one. Now, there's many medications that are not herbs, especially that we don't want to use in Coumadin. There's too many to list.
You mean use with Coumadin?
No, we don't want to use them. So any herb you might be taking, there's a big list of those to look at to see which ones might be.
So the interaction between the two are very dangerous.
So I think that this field of integrative medicine is very, very fascinating, and it's continuing to grow by leaps and bounds. But I think as we learn more about this, I think the key thing I like to tell our audience today is get back to the Bible and make sure, as you ask the Lord about these treatments, see if you can read about it, find out as much as you can, see if it makes sense physiologically. Make sure it's not harming anyone.
Standpoint.
And first, do no harm. Okay? I think all this is very important. And as people do this, I think more and more people, physicians, are going to use this integrative approach. We hope this program has been useful to you, and thank you for joining us today, for you are fearfully and wonderfully made.